Assalamu alaikum, welcome back to my channel. My name is Kuratulan and we are preparing Nclex RN exam all together, okay? As I did myself, as I get successful in this exam, I'm sharing all the tips and tricks with you guys, okay? First, you need self-motivation, positive energy and well-planned mind, okay? Set your mind that you are going to be successful in this exam and remove all the negative energy as I said before. And the second step is you have to read Saunders' book that we are going to do now. Okay, we are on chapter 5 and today's topic is coronavirus. Okay, guys. So as I'm telling you that the second step is to read Saunders' book and to understand. After the reading and understanding, you have to go for all practice tests. Whatever you find on the media, on your book, or wherever you find your practice tests, do all practice tests with your rationals, okay? And then you must be successful in this exam. Let's go and start our reading from Saunders' book word to word. Just my honest tip that if you don't have time, don't worry, just listen about the test, listen about the topics and try to understand, okay? Let's go and start reading. So guys, welcome back for reading and understanding Saunders' book word to word. So today's topic is COVID-19 coronavirus. So we are going to read from here. As you see, this is pyramid of success. So A, the COVID-19 pandemic is a serious global health threat and is a major public health concern. It has caused severe illness and even death in some individuals. So guys, as you know, it is very popular topic. It is everybody, they have gone through this all situation. We have seen by our eyes, we are eyewitness for this situation. So we know very well. B, risk for contracting and becoming severely ill or dying from COVID-19 may be higher for certain populations. Those at high risk include the elderly, those with a chronic health condition such as diabetes or respiratory or cardiac disease. So nurses, you were working in the wards, you know very well that they have immunocompromised patients like diabetes, respiratory, cardiac disease. They were really on stack. Those who have cancer, those who are immunocompromised from chemotherapy or a disease and minority groups. Then this is a link. If you want to go through, you can follow this link and go through again about racial disparities, about minority groups. Number C, it is considered a respiratory illness that is caused by a virus called SARS-CoV. Although the illness is respiratory in nature, the virus also attacks and affects many different body systems. Number D, symptoms of the illness include but are not limited to cough, shortness of breath, respiratory congestion, fever, muscle pain, sore throat, and loss of taste and or smell. Additional symptoms include body aches, fatigue, runny nose, and gastrointestinal symptoms such as nausea, vomiting, and diarrhea. E. Be alert to emergency warning signs for COVID-19 requiring emergency care, difficulty breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face cyanosis. COVID-19 is a highly contagious illness and controlling its spread is a primary goal. Number G, other population groups at risk are those who are living in crowded conditions or who are institutionalized, such as those in a nursing home or in a prison. As you know, guys, it was spreading by it was airborne disease and spreading by where it is crowded. So nursing home and prisons, they are always crowded. They are people. They don't have long distances. So it was mostly found there. Some factors that play a role in increasing the risk for the infection are employment in essential fields such as healthcare environments, inconsistent access to healthcare, stress, and low immune response. So when performing an assessment on a client, the nurse must assess for any risk factors for COVID-19 and must institute safety measures for protecting. Let's go for J now. So, sorry, J. Okay, this is I. Okay, G, sorry, I, E, F, G, I. And then we go for here, protecting. Leading causes of death being cancer, heart disease, and stroke. This red alert, we never miss to read and to understand because it can be an exam question or something related to exam. Some people in minority groups report hesitancy in seeking healthcare due to language barrier, inactive communication between the nurse or other healthcare providers and the client can affect the client's healthcare and the client's ability to comply with follow-up care. So we were reading I when performing an assessment on a client, the nurse must assess for any risk factor for COVID-19. Let's do again. Number I, when performing an assessment on a client, the nurse must assess for any risk factors for COVID-19 and must institute safety measures for protecting. Then we go for this and preventing that client from contracting the illness. The nurse needs to be aware of the critical measures needed to protect oneself from contracting the virus and must be an advocate in educating the public about the measures to prevent spread. These primary measures are hand washing, wearing a mask and eye protection, physical distancing, avoiding crowded situations, avoiding close contact with people who are sick, covering the nose and mouth when coughing or sneezing, keeping the hands away from the eyes and face and self-quarantine. Okay, refer to chapter 23 and 41 for information about COVID in pregnancy and in children and chapter 51 for additional information on adults. This is gonna be later on, okay guys, because we are reading word to word. We will go for that later. So, minority groups. Which are the minority groups we are going to read about? A. Minority groups are more often affected by healthcare disparities than non-minority groups. Some individuals in these groups may be less likely to have health insurance coverage or a regular source of healthcare. Okay, then this is kind of link they have given. Number C, obesity, diabetes mellitus, end-stage renal disease secondary to diabetes and cervical cancer or more common among the Hispanic American Latin population. Number D, the native Hawaiians and other Pacific Islanders population is noted to have high rate of smoking, alcohol consumption, obesity and diabetes mellitus, hepatitis B, human immunodeficiency virus, HIV, and acquired immunodeficiency syndrome, AIDS, and the tuberculosis are more frequent disease. Noted is that there is a high incidence of infant mortality and sudden infant death syndrome in this population. So in the native, because we are reading about minorities, so you will find different kind of nationalities in these minority groups, and sometimes it is exam questions as well. E. In the Native American and Alaska Native populations, geographic isolation and income may be factors with regard to receiving health care. Inadequate water supply and sewage disposal can be a factor. With infectious disease, smoking and the use of alcohol are more common. And diabetes mellitus, cancer, stroke, heart disease, and accidents are a concern. Additional concerns include mental health, alterations, suicide, infant mortality, sudden infant death syndrome, teenage pregnancy, liver disease, and hepatitis. F. Obesity, diabetes mellitus, hypertension, heart disease, asthma, and cancer occur more commonly among African Americans, with leading causes of death being heart disease, cancer, and stroke. Cancer, tuberculosis, and hepatitis are more common health problems of Asian American, with leading causes of death being cancer, heart disease, and stroke. So guys, we are on chapter number 5, unit number 2, professional standards in nursing, and page number 71. You can imagine this book has page 1258 and we are on 71. But be consistent, okay? Be positive, stay with me. We are going to read. I'm going to read, you guys just listen. It might be something click in your mind. So, some people in minority groups report hesitancy in seeking healthcare due to a language barrier, ineffective communication between the nurse or other healthcare provider, and the client can affect the client's healthcare. And the client's ability to comply with follow-up care. So, guys, here number H, as you know, this is the sign that you must read this. So be attentive here. Number H, healthcare consideration for minority groups. Be attentive, guys. Number 1, culture responsiveness is critical in the effort to reduce healthcare disparity and is a necessary ability for healthcare professionals to acquire in order to provide care for a diverse population. This can help improve health outcomes and quality of care. Number 2, the nurse and other healthcare professionals need to be aware of healthcare variations and risk factors for various population in order to facilitate appropriate care and access to needed healthcare services. Number 3, it is important for the nurse to examine their own values to be responsive to the needs of someone from another population group. Awareness is a useful tool in caring for others. Number 4, language barriers influence access to healthcare. It is important to remember that family members and friends must not be asked to be an interpreter for the client because of confidentiality. Listen guys, you have to be careful about this. I'm going to read again so you will see what I'm saying. Language barriers influence access to healthcare. It is important to remember that family members and friends must not be asked to be an interpreter for the client because of confidentiality. The potential for conflict of interest. I think this is something like the conflict. And the risk associated with relying inaccurate information and specified individuals and designated by the healthcare agency should be asked to interpret for a client. Number 5, lack of access to preventive care needs to be addressed. Lack of routine health care and delay in seeking health care for illness are common. Some important educational health topics include diet, meal planning, exercise, and other lifestyle practices that help prevent disease, including infectious and communicable diseases. Number 7, written explanation and demonstration teach back are of particular importance of ensure safety and mutual understanding. So guys, here again we are going to read this. Lesbian, gay, bisexual, transgender, queer, intersex, asexual individuals. They have rights as well, so we have to read about them. A, commonly referred to as the LGBTQIA community, this group is represented by a wide range of varying characteristics. Guys, we are nurses, so remember we have to respect humanity. So that's why this topic, you need to, whatever is your belief, but read and understand respectfully because it is going to become in the exam. So, there is often a lack of awareness and understanding among healthcare professionals in managing the healthcare needs of this population. As I said before, providing access to healthcare that meet their needs is critical. See, some LGBTQIA persons may be less likely to access healthcare than other population groups due to fear of stigmatization and being viewed as different. Okay. Then here, transgender individuals may be less likely than other groups to have certain screenings completed, such as mammograms, breast exam, cervical cancer screening, testicular cancer exam, and prostate screening. For individual information, refer to the GLAAD Media Reference Guide Transgender 8. Then there is a website about this. If you want to go, you can go on this website and read more and have more information regarding this topic. Sexually transmitted infections are of concern in this population. If breast cancer and cervical cancer are a concern problem, probably as a result of decreased screening and nulliparity. Depression and suicide are concerned. Rejection from friends, family members, and social support system may be a stressor. Teenage members of the LGBTQI population are more likely to be threatened, bullied, injured, raped, and victimized. For these reasons, school absenteeism can be a problem. LGBTQIA youth are at risk of abuse by family members due to their sexual orientation. Many same-sex couples desire children. There may be some barriers to child rearing, such as the expenses associated with adoption, artificial insemination, and surrogacy. Again, this read. So read, understand, and listen, guys. Members of the LGBTQIA population are less likely to have family members who can assist them with elder or disability care. Additionally, certain benefits such as spousal death benefits may be unavailable to them, which could impact their ability to manage finance and healthcare expenses. Healthcare consideration for the LGBTQIA population. Healthcare professionals need to create a welcoming, non-judgmental environment when caring for this population. Using the correct pronoun is important in developing and maintaining a report. So guys, as you are watching, if you are watching, you see this red bullet, pyramid of success. These are the points that you will, consider like an exam question. Measures such as altering signage on paperwork and documents asking for gender identification will better serve the health needs of this population. In addition, the healthcare facility must develop institutional policies including all gender identities and preferences. Such measures will allow care provider to treat the client according to their identity, while also maintaining and understanding of their risk factor based on biological drivers of health. Health promotion measures need to focus on screening for health concerns such as cancer, sexually transmitted infection, depression, and suicide, and on educating on safe sex practices. A careful sexual history and appropriate counseling are important for all members of the LGBTQI population. So I said we are going to read about corona, but we are covering minority group as well in this video. Non-occupational post-exposure prophylaxis, or the use of prophylactic antiretrovirals before and after potential HIV exposure, needs to be considered. Transgender persons taking hormone therapy need to be monitored at regular intervals. Associated complications such as polycythemia occurring with exogenous testosterone use need to be detected and treated early. Transgender persons who have undergone sexual reassignment surgery need to have the respective preventing screenings. For example, persons who have undergone male to female reassignment need to have breast cancer screening by way of mammography if they are older than 50 years. Additionally, female to male individuals should still undergo mammography routinely as individual indicated due to the risk for individual breast tissue to develop cancerous growth. So the next topic is homeless, but I think I told you to cover just coronavirus, but I covered minority group as well. So we read about coronavirus, we read about minority groups. Okay, hope you understand what I'm talking about, or maybe it is a bit helpful for you to understand, to listen when you listen this, because then you will have self satisfaction as well that you did not miss any word of this book. Okay, so the next topic, next video will be homeless, and we will do this video for the next session. But I hope this is I made it very small video. Kindly listen this video, subscribe my channel, and support, and give nice comment, share, and I will do next video on homeless then. For now, bye for now, and see you in the next video.